you will reverse diabetes, decrease visceral fat, and decrease the risk of cardiovascular disease in 6 months. There's such a bidirectional influence of testosterone and metabolic health. And we're seeing, again, how our metabolic health has completely deteriorated. Now we have even young kids, children with type 2 diabetes. So there's a very strong influence that patients with metabolic syndrome, and metabolic syndrome is a whole spectrum, whether you just have increased visceral fat, prediabetes, diabetes, all of this, usually insulin resistance at the base of this, and usually is associated with inadequate or low testosterone. So when I see patients with metabolic syndrome, when they're on that spectrum, I definitely check their testosterone levels. If it's not adequate, you either replace testosterone, or even if it's not at the level where you need testosterone, there's even studies that combining any testosterone treatment with Clomid or HCG that increases your own testosterone, you'll get much better results. And lately, with the advent of the GLP-1 agonist, something like semaglutide that is now, it's been, I think, approved in the EU to be used in tirzepatide. The success that I have in reversing diabetes or prediabetes in my guys is crazy. So a combination of testosterone and one of those tide medications, so testosterone and tide, I call it the Tsquare stack. You will reverse diabetes, decrease visceral fat, and decrease the risk of cardiovascular disease in 6 months. I have patients who were sent to me and labeled as non-compliant with their diabetes. Of course, if you have diabetes, your testosterone doesn't work well, it's hard for you to go to the gym. So it's a vicious cycle. So you fix the testosterone, you fix the insulin resistance, you get on that testosterone in one of those tide medications, and you'll get amazing results.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.